Hello and welcome to Research in Dental Hygiene. This lecture will serve as a basic introduction to dental hygiene research, and let's get into it. So, why would we conduct research, especially as dental hygienists? Well, we need to conduct research because it's necessary to developing new programs and to evaluating existing programs in dental public health. And ultimately, as dental hygienists, we are serving the public health as a dental professional. Dental hygienists' conduction of research and evaluation assists in the decisions surrounding treatment modalities and products. So even if you're not working in a public health setting, you're working in private practice, you're going to want to understand research and even potentially be conducting research because it's going to make you better at recommending treatment and better at recommending products. So there's an analogy between private practice and research methodology in that it's almost exactly the same in the way that we treat our patients is how we go about conducting research. So it's very simple to, hop over from private practice to research. In that, when you are working in private practice, your patient will identify a chief complaint for you. But if you work in research, you have to conduct surveys or make observations about the problem, about a population's problem. And then in private practice, you might take down a health history, whereas in research, you would conduct a literature review. And in both of those, you're collecting information about whatever your topic is. In private practice, you'll then make a diagnosis, right? Or if you work in a state where you can't make a diagnosis, your dentist will. And if you're working in research, you're going to develop a research question or a hypothesis in order to help you, test whether or not the research question that you have is good. You're going to determine a treatment plan if you're in private practice, whereas if you're in research, you'll write a research proposal. If you're in private practice, you'll obtain informed consent and you'll obtain funding, essentially. The patient will pay for whatever treatment that you're recommending. In research, you'll obtain informed consent, just like before, and you'll obtain funding. Although it's not a patient who pays, it's usually a grant or some type of sponsoring. And then in private practice, you'll initiate treatment intervention. Basically, you'll, provide the dental hygiene service, right? In research, you'll conduct the research study. Like you proposed, you'll, go through and you'll conduct the experiment. And then in private practice, you will do some type of recall or reevaluation, right? When the patient comes back, you're going to look and see, did the treatment work, right? In research, at the end of the research study or the end of the experiment, you'll try to analyze and figure out, was your hypothesis right? And then you'll publish that research. So using research to practice dental hygiene. In order to do this, you have to accurately interpret research. And the dental hygienist must understand the basic research principles in order to accurately interpret research, right? The dental hygiene is based upon research and the results that it yields. We might often think, especially when you're in school, that the instructors are giving you information based on how they want something done or how they did it, but most of the time, instructors or professors, they're looking at the research as to, not only what is the best way to practice dental hygiene, what's the most efficient way to perform a specific procedure, but also what's the most effective or scientifically proven method for educating young dental hygienists. So a lot of research goes into every decision that is ever made. Public health research, so here the study of a disease in populations is going to be accomplished by conducting research using the scientific method. But what is the scientific method? It's a body of techniques that use observation, reason, and experimentation to gather evidence that is empirical and measurable. So in scientific method, there is a specific way to go about gathering information, about analyzing that information, about testing whether that information is correct or not, and then making sure that the information you're getting is actually a fact, that it's not something that is, subjective. It has to be absolutely objective. And when you are gathering information, well, the information you gather has to be measurable, or else how will you gather it, right? I just liked this quote, and I thought it was a cool time to put it, but it says, supposing is good, but finding out is better. This is the main reason I like research, because I like being able to learn more about something and not just have to wonder if it's true. Evidence-based practice. So the concept of evidence-based dental hygiene means that students learn the practice of dental hygiene is based on independent research done by other practitioners and scientists, as reported in peer-reviewed medical and dental hygiene journals. That this concept right here of evidence-based dental hygiene, basically peer-reviewed journals and everything like the science-wise, right? The evidence that we look for. This is only 1/3 of the information that you have or will need to have in order to make clinical decisions based on this concept of evidence-based practice, which we also call evidence-based dental hygiene. And so this whole concept of reading research and gathering information that others have conducted studies on, that is only going to be this best evidence that we have right here. It does not include this clinical experience or this patient preference. And that these two components are just as important as the evidence that we might collect. And it's important because let's say you are really, really great at using the Cavitron, but when it comes to hand scaling, you're not that great at getting the distals of whatever, right? So when you are trying to decide how best to go about cleaning someone's teeth, you're going to probably lean more towards using your Cavitron than you will towards your hand scaling skills, because a clinical experience tells you that you are maybe weak in that area, right? And every person is different, and you're obviously you're going to work on that skill, but for now you understand that about yourself, right? So you're going to take your clinical experience into consideration when you go about performing treatment. In the same sense that if your patient has preferences, so if they absolutely hate the Cavitron and they will not let you clean their teeth with it, then you cannot then just rely on your Cavitron in order to clean their teeth, right? Their opinion and their boundaries matter when it comes to performing treatment or getting them to agree to treatment, right? And so you cannot just ignore what your patient wants or what you're good at when it comes to recommending treatment. You don't just give them the evidence. You can't just go off of studies and say, this is what we're doing no matter what, because it's not ever that black and white. There's always tons of shades of gray when it comes to what type of treatment is the best treatment for that specific individual and being performed by that specific clinician. Every clinician will go about choosing treatment differently, and every patient will go about accepting treatment differently, even if the evidence says to do the same thing in every case. So what is non-evidence-based decision or evidence-based dental hygiene? This is going to be trial and error. So you would not say, I know that the science says that we should do, fluoride, but I think we're going to put this totally different product on your teeth and we'll see how it goes, right? We don't do that to our patients. If the new product hasn't been tested and isn't proven to be effective, then we don't do it. We don't trust anecdotal reports. So an anecdote is like a personal story or a personal history of them telling you about something that has happened. And so, even if a dentist or a periodontist comes and says, well, I do this because I have all of this, successful periodontal treatment, and they're just telling you specific stories, well, that's not necessarily going to be information that is something you're going to want to use. You're going to want to look at the research and the reason behind why whatever treatment was done in order to figure out if that's the best treatment for your patient. Don't just trust someone because they have some type of authority. And then the selection of oral care products because of advertising. So I'm a a tough person when it comes to dealing with like the sales reps, because I don't believe them whenever they talk to me. It's not necessarily that, everything that they say is wrong, but they are not always able to look objectively at their product, and that's going to be really important for you as a hygienist to look at the products and the information that they give you objectively to figure out, is this actually a good product, or are they just telling me it's a good product because they want to sell more things, right? A good example of evidence-based dental hygiene, this comes from your NAES book, was that at one point they used to think that plaque had to be completely removed from the surface of the teeth before you could put fluoride on it. That if the plaque was there, then it would somehow block the absorption of fluoride. And after they did a study, they found out that that's not true at all, right? That fluoride could be absorbed through the plaque, and that it didn't interfere whatsoever with the penetration of fluoride. And so it completely revolutionized the way that public health hygienists went about recommending fluoride treatments, right? They no longer had to be held to doing a prophy on the child before they could apply fluoride. And it made it to where they're able to provide the application of fluoride services to just an exponentially greater number of children, because they no longer need to provide a prophy beforehand. And I think that's a big deal. Isn't it amazing how research can change? Something that was once widely believed, and then they do a study and find out that actually, no, that's not even true. So some of the skills that you're going to need in order to provide and to practice with evidence-based dental hygiene is going to be first to understand, right? Evidence-based. So you can go back and listen to that one slide with the three, the empirical evidence, the clinical experience, and the patient preferences. Each one of those things, and this is a very possible test question, each one of those things is equally important. No one factor is ever more important than anything else. So yes, the research is fine and dandy, but it's not more important than how your patient feels about it. It's not more important than whether or not you are capable of providing that treatment. So just so you know, no one component of that is ever more important than the others. You're also going to need to follow a systematic approach, and we're going to talk about that step-by-step approach to asking these kinds of questions and to developing and understanding whether or not the treatment is good or the recommendation is good. You're going to have to be able to read and understand research, and that is my goal for this course, is to help you become confident in reading and understanding the research that you are looking at. You'll have to be able to recognize whether it is valid and reliable information, and that's a whole module that we'll talk about. You're going to need to be able to determine the strengths and the limitations of publications, and again, that's something we'll talk about. You're going to have to stay computer literate, so just understand that the newest information is always going to be found online in kind of those journals and those studies. That's where the information that is the most current and up to date, and that's where you're going to want to spend your time reading. You're going to have to embrace self-directed learning and to create a plan for continuing education. So no one is going to come along once you graduate from hygiene school. No one's going to come along and say, okay, year one, you need to take this course and this course. Year two, you have to take this continuing education and this one. No one's going to do that for you. And so it's been proven that the longer it's been since you graduated school, the further you are away from practicing to the current standard of care. And it's really important as a hygienist that you maintain your continuing education and that you take continuing education in things that are not only challenging for you or that you once felt were challenging, but also things that you felt were comfortable because you never know what new information has come out about whatever the topic is. And so, my recommendation for you when it comes to continuing education is to take something you're not comfortable in and take CE in things you are comfortable in. And it's also kind of nice to take CE in something you know, because it's a wonderful refresher. And then because you're taking all of this continuing education and you're reading all of these research studies and you're staying so current, you're going to become a resource for other people. People will come to you and ask you, hey, what do you think about this topic? Or what do you think about this product? Or, how do you go about treating patients in this way? And that tells you that you're doing something right when you are being asked those kinds of questions. You're going to be a source for your other dentists and dental hygienists and assistants in your office in order to help them stay current in the same way that they're going to take CE and help you stay current, because the amount of information that gets published on the internet is vast, and no one person could ever possibly read and understand and interpret and analyze all of that information. I wish I could, but at some point we have to understand our limitations as human beings, and we can't. And so this is where relying and leaning on the other professionals that you are around is a wonderful way for each of you to help everyone else be better and to stay current. So that systematic approach that we need to have whenever we are, not only looking at treatment modalities, but also, when the sales reps come into your offices and they ask you, to start using whatever their product is, right? And you have to have a systematic step-by-step approach. Well, this is that. And we're going to go through each one of these. The first thing you need to do is to assess the situation or determine the clinical issue that is occurring, right? This is going to require that you do a complete assessment of the patient or the population. Remember from public health where you have to do a needs assessment? Well, that's this part right here. You're going to figure out what is their problem. What is the thing that is plaguing either the patient or the population? Then you're going to have to identify what that issue is for the patient or population. And the purpose here is going to be to clarify the issue or the problem. So I know it feels like I said the same thing 3 times, but let me give you an example. So I was in private practice one time. A patient comes in and says that they have a toothache. This one tooth is really bothering them. And I said, I start gathering information, like, is it sensitivity or is it like a sharp pain? And they say it's more sensitivity. And then I ask, well, do you grind your teeth? How do you brush? I'm asking all of those kinds of questions to figure out what could be causing this. Is it a bruxism issue? Is it a dietary, like acidity issue? Is it, like a toothbrushing with like the scrub method kind of issue? If it is bruxism, it could possibly be a fracture on that tooth. I'm going down all of these different avenues with my patient. And by the end of it, I'm like, I took a PA of that tooth, and I tried to determine, is this patient, what do they need, right? I ended up saying, you might be better off with getting like a night guard of some kind, right? Bruxism is, I'm looking at their teeth, bruxism is definitely something that they're doing or have done in the past. I don't have no way of knowing if it's current. And so I'm recommending a night guard to the patient, possibly, right? Well, I'm telling the dentist might recommend this, right? Because I'm usually pretty confident in the way that my dentist recommends things, right? So dentist comes in, I explain these factors to the dentist, and then he asks the patient a question of, is this a tooth pain or is this gum pain? And the patient says that it's his gums. And I had one of those moments where I realized I didn't get all of the information that I had to have before I started looking at what a possible solution would have been. I didn't have enough information, and it's a little embarrassing to tell that story, but I just want each of you to remember that you know, you can never ask too many questions. You can never find out too much information about whatever the patient's chief complaint or chief concern is before you make a treatment sort of recommendation or you give that patient education. You can never ask too many questions. Next is ask. So this one is more research, but you're going to need to develop a researchable question. And there's specific criteria that go about making not only a whole research question, a question that has all of the components that are necessary to make it, you know, a good question, but also there's components about what it is you're studying that will determine, you know, whether or not you should continue with your research study. So asking the right question is fundamental. It's critical to the evidence-based decision-making process. And in this, in order to find out whether it is a complete question, we're going to be using Pico. And if it is something that is even worth studying, is going to be a finer criteria. We're going to go into each of these. So Pico, this one is, it starts with a P, and I want you, the very first thing you think of when you think of P for Pico, it should be problem, okay? I know a lot of times the students get really hung up on patient or population, and they think about, you know, either the patient or the population that's having this problem, but ultimately P stands for problem, and obviously a problem is being had by someone, either a patient or a population. So when you're writing your statement, you'll include if it's a patient having it or if it's a population, but ultimately, again, P equals problem. So what are the main characteristics for your study? Who, and more importantly, almost what is the problem that they're having that we're studying? The I is going to be the intervention or the exposure. So in a normal sort of like what you think of when you think of a research study, right? You think of an experiment of some kind. And so in an experiment, they usually have some type of intervention where they go in and they say, you know, you're going to use this toothpaste, or, you know, we had half of the subjects stop doing something. That's going to be the intervention, right? But sometimes it's also an exposure. So, you know, if it's not like an experimental kind of study, which we'll talk about the different types of studies, there's other kinds. Sometimes we study things that people are doing that we don't have control of, and then we're not studying an intervention, we're studying what was half of these people exposed to. And so what's being done to that patient or the population, either to prevent or correct the problem, or, you know, what's being done to those people, the exposure that could possibly be causing the problem, right? The intervention is I. And then C is going to stand for comparison or control. So again, if we're doing an experiment in a lab, we're going to intervene for probably half or a certain number of the subjects, and the other half, either they get a different treatment or they get no treatment. And so a different treatment is going to be something that is a comparison, or if they get no treatment whatsoever, then they're considered a control. Okay, so those words should be vocabulary we put kind of in the back of our minds for later. A comparison is a different treatment, and a control is no treatment. What's happening opposite to the intervention? And then O is going to be the outcome. And in a research study that you might be reading about, this is going to be the end result. So what happened at the end of that study? Did they prove their hypothesis? Did they, you know, prove their hypothesis wrong? Like, what happened, right? If you were writing a research proposal or you're writing a research question, you're going to write about what do you think is going to happen? What's the desired result? Desired is a little bit of a nuance there, because we don't, as researchers, we don't necessarily want a specific outcome, but we do want an outcome, right? We want to know whether or not what we think is going to happen will really happen. So, yeah. Then if you have a whole research question, right, you have all of the components of Pico. If you want to have even better, research question, you're going to follow this, and it's going to make your question even finer, which is pun intended. So F is going to stand for feasibility. So are all of the necessary resources available? If you're studying, salivary enzymes to determine, calculus production, then you're going to probably need to have the resources of a lab and some lab equipment that can actually, measure and synthesize salivary enzymes, right? You can't just do this in private practice. So you're going to need to have all of the requirements, the researchers, the subjects. You're going to have access to the subjects. You're going to have some type of data collection that is available to you. Next is I. This is something that's interesting. So, most people think research is pretty boring, but the people who conduct research actually, they come up with a question that is usually pretty interesting. And, if you're not interested in the question of the thing that you're looking up, then maybe find something else to research, right? You should be interested at the end of the day. Novel is that the research question that you're asking, or the research that the study that you're proposing to conduct, it should be innovative. It should be new, right? And so we don't necessarily want to research or conduct research on things that have already been, nothing's ever irrefutably proven, but we don't necessarily want to conduct research to try to prove something that's already been thoroughly researched. We want to find the gaps in the literature and answer those questions, the things that we don't understand about whatever the topic is. We also want our research to be ethical. So this is going to be a whole module in this course, and it's trying to determine whether or not we have, ethical or legal obligations to the subjects or to, the information that we're gathering. And the answer is always yes. So if we're studying people, we have an ethical obligation to them. And does the research study that we're doing, does that align with our ethical and legal obligations to those patients, or not patients, but subjects? Last is R, and that this is relevant. So we don't want to spend a lot of time and resources and money studying something that isn't important. We don't want to spend time studying something that won't help us in furthering our understanding of, in our case, dental hygiene, right? So, we wouldn't necessarily spend a lot of time studying preferences of things unless it helps us understand maybe why patients choose a particular product, or we want to study things that matter, that are important, that will may possibly change the way we choose to treat patients. Next is acquire, and so once we have a Pico and we've made our Pico finer, then we are going to acquire information that has already been published about the topic. And this is going to be our search for evidence, or our search for literature about the evidence, or about the topic that we're looking at. There's 3 different types of information sources where you might find information about your topic. And these are going to be primary, secondary, and tertiary. The main difference between each of these is all about who wrote whatever the article or study or information it is that you're reading, right? So in a primary source, the person who writes it is the researcher who conducted the study, okay? It doesn't get any closer to the actual research study than this person. They are the ones who came up with the research question, they developed a research proposal, they gathered information the entire time, and then they analyzed that information, and they are sitting down and writing the results of the study that they have put, their blood, sweat, possibly tears, and their hard time and money and everything into. This is the person who conducted the study, okay? That's primary. Secondary is someone who reads the primary source, and then they they know some things about it, right? And they synthesize or they analyze that information and they kind of reword it for someone else to read. And so if you're reading a secondary source, this person did not write the study, but they read the study, okay? In a tertiary source, this is someone who is reading many sources, and they're kind of comparing and contrasting, and they have kind of a longer viewpoint. They're looking at all of the information about whatever that topic is, and they're writing about it in that manner. And each one of these sources has its pros and cons for why we might use whatever that information is. So in a primary source, this is something where you want the most up-to-date, current kind of information. Right? That's the pro, is that it doesn't get any hotter off the press than this source. But with a primary source, one of the cons or the negatives is that if they just conducted this research study, then what if their research study had bias or it wasn't a very good research study? And so the outcome or the information that they're publishing, it could potentially not be that good, right? Studies need to be replicated. They need to be done again before it's really kind of a true fact. And so the pro is that it's very, very current. The con is that they may not always be right. We can never, change our treatment based on one research study. Secondary sources are fantastic at being able to give us semi-current information, and it helps us to have a bit of a perspective about that information. So usually with a secondary source, there is the introduction of something called bias, right? There's bias in primary, but less so. In secondary sources, it's usually like they have chosen to include certain people or certain studies, and they've chosen to exclude certain studies on the topics. And while they do so for a reason, it's not always necessarily the correct choice, right? And so when you look at secondary sources, they're fantastic because they give you even more information about a topic than one primary source alone could do. But you have to pay a little bit more attention to, what things they included and what things that they didn't, just so that you don't end up trusting their opinion about that topic. And then in a tertiary source, in this one, they've probably conducted so much research, they've read so much information about whatever the topic is, and usually they've included everything. They haven't done a lot of excluding about whatever their topic is, and so they have usually very factual information about whatever the topic is, right? Because they have a lot of information about it. But their con is that it's not very current. So, when you look at a tertiary source, and in this I talk mostly about textbooks, because textbooks are written, like the information is collected from primary and secondary sources, and all of that information takes time to collect and to read and to synthesize, and then they decide they're going to write a book, and then it takes several years actually to write a book, and then it takes time for the publish to publish it, right? It takes time to print it all and make those books, and then to distribute to the different schools or to the different places where the book will go. And all of that information, analyzing and then publishing, it takes time. And so they will not be as current as the other primary and secondary sources will be. However, they will have usually less bias than the other sources will. So pros and cons. This other point here is peer review. This is not something that's really discussed right now in your book as far as what it is, but this term is used a lot in your textbooks at this point. And so I want to make sure you understand exactly what a peer review process is and what it looks like. And so in this, I'm going to talk about you as the person who wants to publish something, right? Like let's say you conducted a research study, you're the primary source, by the way, and you want to publish this research study in the Journal of Dental Hygiene. And when you do that, you're going to obviously conduct your study, write your paper about it. And then you're going to submit your paper to the journal, academic journal, for the peer review process. And the journal itself is going to employ certain experts in the field and people who understand not only the information that you're writing about, but also understand the research process of it. And they're going to have those experts read your paper and determine whether or not your study was conducted well or whether it had some inherent flaws in that process. And they're going to look at that information and figure out, is this something that is factual, or is there a lot of bias? Is there a lot of problems with this study? Now, it's never something that is subjective, right? They're not going to say, we don't want to publish this because we don't agree with it. That's not what they're doing. They're looking at the information to determine, did you collect information, and does that information really relate, and can we use that information you collected to actually make the claims that your research study paper will make? And so that's kind of how that works. They determine whether or not your paper should be published. If they have inherent problems with your study, then they'll kick it back to you and say that, we are concerned about this and this and this kind of part of your research study. And that's how do you need to conduct another research study, or, is that just not the right academic journal for you, right? But if they decide to publish it, then that means that you had peers or experts in your field. They reviewed your paper and then agreed that it should be published. Next up is appraise. And in this one, we're going to self-review, right? We talked about peer review. So we'll self-review the information that we're reading. And if you're reading an article that's already been peer reviewed, you're still going to want to appraise that information for this part here, but you're going to evaluate the evidence to determine whether that information, the paper, the article, or the report, follows a logical and complete steps of the research process. So did they do everything that they were supposed to do in order to be able to produce valid results, right? You're going to determine whether the focus of their study is similar to the patient's concerns. And in this one, that's whether or not you're going to use this research study information on your specific patient. So, if they're writing a study about whitening for someone who has maybe triclosan stain, and you are trying to talk to your patient about whitening, but they don't have triclosan stain, then that study is not very relevant for your patient, is it? So you're going to want to find research studies that are similar to what your patient needs. You're going to determine if objectivity was maintained or if bias was introduced. And in this, we want to make sure that there's no subjectivity in our research, right? You're going to determine if the study had an adequate sample size. So there's different types of studies, and different studies have different sample sizes, and we'll talk about those later. You're going to determine if the most appropriate measurement scale and/or index was used. And again, we'll talk about that later. Can the evidence be generalized to other similar patients or populations? Sometimes they'll do a study and where they, subjects live in a lab and they do some type of intervention and they find out that it works great. And sometimes, even though it worked great when it was in the lab, it doesn't necessarily mean it's going to work great for your patient who doesn't live in a lab. So this is the part where we have to figure out, okay, well, this is how they conducted the study. And does that mean that, my patient is similar to that, right? That's something that we want to know. Next is apply. So if we found a research study that was, similar to our patient and could be applied to the population that our patient, is a part of, then it might be time to integrate and to apply that evidence-based information to the kind of information that we either educate our patient with or we use when we create a treatment plan. So we're going to want to integrate and apply the evidence with the clinical expertise and the patient's preferences, right? So let's say, our patient wants whitening, and we are going to read the research studies and find out that, carbamide peroxide is very effective, right? Oh, but maybe we read a research study where hydrogen peroxide was, faster at whitening. And we're going to talk to our patients and say, do you want whitening or do you want faster whitening? And patients will usually say that they want faster whitening. But your clinical expertise is going to tell you that carbamide peroxide doesn't produce as much sensitivity as does the hydrogen peroxide. And so when you look at your patient and the patient says, well, I want really fast whitening, but about that patient that they have some sensitivity issues, then your clinical expertise is going to jump in and say, maybe we should recommend this, or at least, the very minimum, we educate the patient on the fact that hydrogen peroxide causes slightly more sensitivity because it works faster than does carbamide peroxide, which gives us a more consistent but unfortunately slower results. And so you're going to consider the patient or the population's circumstances and the clinician's ability to help obtain potential results. And through all of that, you're going to have read the research to find out that both carbamide peroxide and hydrogen peroxide are effective at whitening teeth. Next up is to audit. So here you're going to evaluate the outcomes. If we continue on with our, whitening scenario there, your patient comes back later, right? And you're going to check the shade to see, did the patient's teeth get whiter or did they not, right? So here you're going to determine whether the application of our evidence-based practice model successfully helped the patient. Did their teeth get whiter? We're going to have to determine if there's a need for additional research strategies or information. Maybe they didn't get whiter. Maybe, the patient does have triclosan stain, or maybe they're about as white as they get, right? And so we have to go back to the drawing board and figure out, what's going on here? Why didn't it work? And we might need to determine whether there's a need for a modification in the original outcome goal. So maybe the patient's teeth are as absolutely white as they get, and so the modification here is that the patient needs to kind of set more realistic expectations. Either way, begin the evidence-based practice process again if the patient outcome is not successful or when a new problem arises. This is the kind of the end of our 6 steps, or the 6 A's of our systematic approach. The next things we're going to talk about for this is going to be the approaches, the different types of approaches to our research studies. And so we're going to go through the different research designs, which are qualitative, quantitative, and mixed methods. And we'll talk about the different research types. Neither one of these are they like research studies. So we're going to talk about research studies next week, but we're going to talk about kind of the categories that research studies fall into this week. First up is quantitative, and quantitative is probably similar to what you're thinking of in like the quantity and quality, right? So quantitative is going to test hypotheses. They're going to look at the differences between the causal or correlational relationships, and they can be used to make predictions. Their sample sizes are typically larger, and usually they are randomly selected. And we'll talk about what all of that means. And then as also the data that's going to be collected and reported are going to be quantifiable numbers. Okay, this is the most important part I want you to get from this. Numbers is what quantitative, right? Or you think more, right? More number, quantity. So data that's collected is going to be reported as numbers. Then we have qualitative, and when you think qualitative, you should be thinking like quality, right? Here, The purpose is going to be to understand and to subjectively interpret complex social interactions. This can sometimes be difficult, right? We're going to have typically smaller sample sizes, and we're not going to randomly select our sample sizes. And then the data that we collect and report through participant observations, interviews, open-ended questions, field notations, and narrative reflections. The main thing you should get from this part is that the data that's collected and reported are going to be reported in words, okay? Words, not numbers. Words, not numbers, for qualitative. So if you think of quality control, right, HR or whoever does quality control, they are going to be putting out their publications, and their types of studies will give us words, not numbers. Then we have mixed methods. And in mixed methods, the idea is going to be to combine the best of both qualitative and quantitative research approaches. So usually what happens is you have the first part of the study, and you gather some type of information, and then that helps you in the second part of the study. And you can do either qualitative first and then do quantitative, or you can start with quantitative and then do qualitative. In this one, the sample sizes and the random selection may vary. And so I'm not saying that this is a test question, but it might be a test question that there's a lot of variability in the sample sizes and whether they randomly select, okay? And then last but not least is that the data that are collected and reported, they can be reported as both qualitative insight and quantitative analysis. So typically when you're doing mixed methods, you will get both words and numbers. Okay, so these are the different types of research approach. And in one of them, a research type is going to be whether or not your study is descriptive or not. In a descriptive study, they're going to focus on describing facts about people, places, and time. Okay, that's going to be the most important factor here, is that a descriptive study describes. It helps to identify basic relationships that further studies will need to examine. And often a descriptive study is the first step in classifying and organizing information. Now, this doesn't mean that a descriptive study has to be either quantitative, qualitative, or mixed methods, but it can be any of them. It's just usually the first part, and it describes. Next is correlational. So a correlational study is just a type of study that looks at the relationships between multiple variables. You could have a descriptive study that is also correlational, depending on, exactly what it is you're trying to describe. And this type of study, correlational, will determine the strength and the type of the relationships. So usually you have two different factors. You are trying to determine the relationship between maybe ice cream and boating accidents, right? You've seen this is my favorite example, but you've seen an increase in both ice cream sales and boating accidents, right? And the main thing here is that you have to focus on preventing the post hoc fallacy. And the post hoc fallacy is that correlation does not mean causation, okay? So in this example of kind of understanding the post hoc fallacy is that you've noticed ice cream sales go up, boating accidents go up, right? But when ice cream sales go down, boating accidents also go down. And if you were unaware of the fact that both of those are correlational and they are not causal, you might accidentally think that people who buy ice cream get into boating accidents, right? The data suggests that these two things are related to one another. And in fact, they are related to one another. But you might be completely refuting the fact that both of those things happen in the summertime, right? It gets hot, So people buy and eat ice cream. And when it gets hot outside, people go boating. And when more people go boating, more boating accidents happen, right? So just because these two things both, go up at the same time doesn't mean one causes the other. Next up is experimental. This is usually the one that people think of when they think of research studies, but they think of, a lab and an experiment that the lab is doing. So an experimental study is intended to test the cause and effect between variables, and we'll talk about what those variables are. Excuse me. Experimental studies do usually include randomized assignment of study participants, and the experimental group usually does receive some type of intervention that the control group does not receive. Typically, when you think of an experimental study, you kind of already know, or your sort of inherent thoughts about what an experimental study is, you're probably right. Quasi-experimental, this is one of my favorite things to describe, is that quasi-experimental, for those of you who are control freaks, this type of study will make you a little queasy because quasi-experimental studies are very similar to an experimental approach, except they don't have a random assignment of who goes into which category. So, maybe they're suggesting to do some type of intervention, but they don't get to decide who gets the intervention and who doesn't get to do the intervention. It's like some, inherent gene or something about the subject is what decides, right? So maybe they're looking to see the difference between people who are introverted and extroverted, and they want to figure out, do introverts do this thing? They don't get to determine who goes into the introverted category and who goes into the extroverted. The subjects decide who goes into which category. So the researchers have inherently less control on the experimental design, and they have less control on the outcomes than most researchers who are control freaks that they like to have. Next up is going to be the levels of evidence. So we're going to talk about each one of these types of studies next week, but the main thing that I want you to understand this week is that they're not all the same kind of trustworthiness, essentially. When it comes to writing and reading a research study, the level of the evidence that they are giving you, the level of the study, should give you a clue in to how much you can trust the information that they're giving you. As you can see here on the side, the strength of the scientific evidence will go up the more it gets closer to the top of this pyramid, whereas if you were to move down the pyramid, then the strength or the trustworthiness of the information that you're getting actually becomes less so. In this one, it is certainly, you're going to see it again, but that the meta-analysis is considered the platinum standard when it comes to levels of evidence. A systematic review is considered a diamond standard, whereas randomized controlled trials are considered gold standard. So these words here on the side, these are going to be important for you when you're learning about the levels of evidence and the types of studies when we talk about them next week. Okay, so another kind of category of the types of studies that we could conduct is going to be the factor of time and how time plays a role in the type of study we're conducting. So vocab here is that longitudinal studies are any study that happens over time. It means that at more than one point, 2, 3, 50 points in time, you're going to collect data about whatever your topic or on the research subjects. So longitudinal happens over time. If you think of longitudinal as long time, it's going to help you out, okay? Two types of longitudinal studies are prospective and retrospective. So I'm sure you can kind of get a clue based on the prefixes here, but a prospective study tells you that this is going to happen over time, starting now, and it's going to continue to the future, right? We're going to start studying someone, and then we're going to study them again later, right? In a retrospective study, so hold on, prospective study goes forward from wherever the first data point begins. And then a retrospective study will go the opposite direction. So you're going to collect data that is about something that has happened in the past. Retrospective means you're going to collect information from before. Prospective, you're going to start collecting now and collect it in the future. Both prospective and retrospective collect data that has happened in more than one point in time, okay? A cross-sectional study is the opposite. A cross-sectional study, if you think about like a cross, right, or an X, they only intersect at one point, okay? So cross-sectional study looks at information from one single snapshot in time. Some of other factors that you need to keep in mind when it comes to evidence-based practice. My bullet points on this slide are all messed up. I'm probably gonna have to fix those. But anyway, a research study, the result from one single research study does not necessarily provide the best answer. Okay, we are unable to tell irrefutably, without a doubt, whether or not the information that that research study collected was a fluke or it was right. And so we cannot just trust whatever one study gives us. It's better when we have multiple studies that are conducted the same way and they all have similar results, which we'll talk about later as far as reliability goes. But when we have more than one study that gives us similar or, the same results, then we have a little bit more trust in whether that information is correct. One study, though, we can't trust it. Not 100%. A statistical significance, which we'll talk about when we get to biostatistics, is going to be cited in a study does not mean that clinically it's the best decision for a patient. We talked about this a little bit with evidence-based practice and evidence-based dental hygiene, but just because the research study says that that's the best thing to do with whatever it is, doesn't necessarily mean that that's the best thing that you should do for your patient, okay? It is important to remember that every patient who sits down in your chair is an individual, and we need to treat them in an individual way. Last but not least on this one is bias. And we talk about bias more and we refer to bias a lot, but I just want to give you kind of an idea of what bias is before we move forward. And bias is something that happens where there's a flaw in the study. And it could be something that was built into the study. Maybe the researcher was uneducated about a certain component in their topic. And so they built this research study and they didn't even consider another variable. Or maybe they did consider a variable and they decided to leave it out because they didn't think that it was important. Bias, if you think about it, it's not exactly the same as like a social bias, right? It's not like racism or something like that. It's more so information. Someone who decides, this information isn't correct or this information is correct, and then they use that information and they make assumptions based on that information, and we don't necessarily know if that's the right information or not. For instance, if you were reading research studies and you decided that you were going to leave out all research studies that aren't written in English because you can't read any other languages, right? You would actually be creating a language bias because people who read and write in English perhaps don't have the same cultural influences or the same understanding of certain components as do people from other cultures and languages and parts of the world, right? So other cultures and languages have a different viewpoint, and maybe they're conducting studies in a slightly different way and getting different results than us. So you would have a language bias in that you don't have that information that they have because you left out that information. Is it understandable to have a language bias? Yes, absolutely. If you can't read another language, then you can't read another language. But it's just important to remember that no study, no matter how amazing it is, has absolutely zero bias. And the idea here is that you're looking to find a study that has the least amount of bias. Last but not least is going to be the concepts of occupational versus professional models. And this is sort of a method that we use when we're practicing in private practice. And there's two in this idea. Hypothetically, there are two different hygienists, and they go about making decisions very differently. So in the occupational model, the hygienist will have mechanical abilities. They have learned how to scale teeth, and that's what they do. They will not necessarily make decisions. They will give information to the dentist and then be told what to do by that supervising dentist. And then they have no ownership over the care that's being provided. Basically, they were told what to do, so if something goes wrong, then it's not on them, right? The opposite of this is going to be the professional model of dental hygiene, and this one is where the information and the treatment that is given, the service is rendered, this is based on solid scientific knowledge base. This is someone who, is constantly updating and improving the information and the skills that they have, kind of thing. They will typically be a critical thinker or a problem solver, so they won't just necessarily give decision-making away, but they'll make suggestions as to what treatment should be rendered, or what services should be rendered, right? What kind of treatment should be proposed. And then in this one, the dental hygienist assumes responsibility for the care that's provided. Basically, if they make a mistake, it's on them to own up to making that mistake. And obviously it depends on which state that you practice in, whether or not you have some control over what goes on. There are states where, dentists or dental hygienists cannot make a dental hygiene diagnosis, many states in fact, and so all of the information or all of the treatment that's recommended has to be, by law, recommended by the supervising dentist. But that doesn't mean that the dental hygienist cannot participate and contribute to making that dental hygiene diagnosis. This one your book talks about it in the Nath book because it's proposed by a Darby and Walsh textbook that is given, and they break these two types of sort of modes of thinking for dental hygienists. And no one of them is inherently right or wrong. The idea is just trying to figure out which type of hygienist you want to be. Obviously, when you read it, it does certainly kind of indicate that one is more favorable than the other, but it's up to you to make that decision ultimately. So in summary from this lecture is going to be that every dental hygienist, whether directly involved in research or not, should be familiar with those basic research principles. That understanding the basic research principles of evidence-based dental hygiene means being able to break down the types of research approaches, which we talked about, and then you're going to, as an individual dental hygienist, determine if you want to practice under the concepts of the occupational or the professional model of dental hygiene. And let me know if you have any questions.